Our key differentiator is that we have set up a really good virtual system, and I don't want to go into the in-person care. I can't differentiate there. What I can differentiate on is the experience that we've built virtually.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Joanna Strober, founder and CEO of Midi Health. In this episode, we discuss the company's digital care platform for women's midlife health. Joanna explains how they're addressing the care gap in menopause and perimenopause treatment. Plus, we talk about scaling quality care, evolving treatment protocols, and building trust with patients. Let's get into it. Today's episode is brought to you by EGYM. EGYM provides fitness and health facilities with smart workout solutions built on its ecosystem of hardware, software, and partners. But it's more than cool tech. Their connected training experience delivers business results while helping members reach their wellness goals. If you run a gym, health club, YMCA, or any kind of fitness facility, you should check them out. Visit egym.com to learn more. Hi, Joanna. Welcome to Fitt Insider. Thanks for joining us.
Thank you. It's good to be here.
I'm excited to chat. I think there's a lot to get into, but maybe we'll just start with the basics, which is what led you to Midi Health.
That's not such a basic thing, but that's because I'm kind of old. But I've been interested in a long time. I like to do things that actually solve real problems. Like, to me, a lot of my life has been, when I was pregnant in 1998, I actually was the first investor in Baby Center, because I wanted to solve pregnancy issues, and invested early in Blue Nile, which was a jewelry company. I like to just solve problems. And honestly, menopause and access to healthcare for women is one of the biggest problems out there. And it's such a big care gap, and the opportunity to solve it is big, and it's just an open field. And so I got very excited about trying to solve that problem.
I think it's more so now in the mainstream, at least I think in our community of people who are building companies or in the health and wellness space of, menopause care and women's health, and how do we tackle this problem? But even when you say you wanted to go about solving a real problem, where do you even start with something like that? How do you start to chip away at such a massive problem?
So for me, the initial massive problem that we wanted to solve was access to perimenopause and menopause care, specifically understanding hormones better and having that covered by insurance. So those are the things that I wanted to initially solve for. There's really two big openings. One was a lack of care and the lack of expertise. And then you combine that with a lack of insurance covered expertise. And so for me, it was, could we start a national company that would give women access to this expert care and get insurance companies to pay for it? So that was what we started with. We found out that once women come to us for perimenopause and menopause care, then they want to stick with us for a lot of other types of care. So we've expanded a lot from what we first started with. But the initial goal was, let's give people access to high quality expertise, to people who understand women's bodies, and give that to you in a scalable manner.
So I think we can kind of talk about maybe what that initial offering looked like and experience, and how and why it's evolved. But when you're talking about delivering that care from I think both the user experience standpoint and also from the kind of care paths, what does that look like in action?
So when we started, we actually did a pilot. I literally went and recruited 100 people and women in this age category. And I said, look, we're going to have providers to take care of you. And we're going to give you 6 months of free care, whatever you need. And we're going to follow you and see, how do we help you? How do we support you? What do you want? Do you want to buy the medication from us, or do you want to go to your drugstore? Do you want us to text you, or do you want a phone call? We spent a lot of time in those 6 months with these 100 women initially, following them really closely. And we learned that, importantly, they wanted to talk to someone. They were not interested in ordering a product on an app. They really wanted to have that personal connection. They wanted to have the products covered by insurance. They didn't want to cash pay for the products. We had thought they would find the convenience of buying hormones from us good, but you know what? Their insurance covers the hormones. They wanted to go get that from the pharmacy, from whatever pharmacy, but have their insurance pay for it. We also learned that, they needed to talk to us in between visits, and we needed to set up something so that in between visits, they could ask us questions. So we really designed this for these 100 patients. And then what the most amazing thing was, we said, okay, the pilot is over. And they said, well, you can't go away. I need you. And that's kind of when we knew that we had something, was when pretty much every one of them said, well, you can't take away my care. I don't have anywhere else to go to this type of care. Can you please continue taking care of us? And so that's a lot of what we did. We really designed for women. We designed for this group of women, but it turned out they were pretty representative of what other people wanted.
I don't think it was, in my mind coming into the conversation, but hearing you talk about kind of the pilot or the beta and recruiting these users and talking to them, having the experience. And then really people talk about finding product market fit. You were kind of pulled in that direction, which is always a good sign. Were you testing multiple ideas? Was this the only path? Like, what if this pilot didn't work? Like, how did you kind of put this together? And in your mind at that stage, like, what was your plan going forward? And thankfully it worked, but maybe what if it didn't?
I was pretty sure it was going to work. So part of it is, I'll give you an example, actually. We started by saying, we're going to take care of only menopause. And then they came back and they said, but what about this? And what about this? And what about this? And so what we quickly found out is that menopause per se cannot be taken care of in a vacuum. It's just part of women's health. So we realized we had to expand the offering quite a bit and change the type of providers that we hired. So initially we were just starting with providers who understood hormones. And we found out that actually we had to have providers who also were internal medicine specialists, because it was such a confluence of both primary care and hormonal care in the same visit. So a lot of what we learned was like, how do people want to interact with their doctor? Instead of us saying, this is how we interact with you, we learned from the women, here's how they wanted to act, and here's the care they wanted. And we also thought, like, for example, actually kind of cool. We said, do you want a supplement path or do you want a hormone path? And you could choose. Everyone wanted the both path. So it was those type of things that we learned. Like, we thought you were either going to be the natural person or the non-hormonal person or the hormone person, but everyone wanted both. And so we had to reshape some of those things. They also didn't want a lot of questions before they went to the provider, because quite often, whatever we asked them, they didn't actually want to discuss those things with the provider. They wanted to talk about something else. And so we had to learn how to change our care to respond to that, because then they would come in with this questionnaire and then they would immediately go to a different question, an entire different thing they want to talk about. We've really tried to design care that women want. And that's how we think of it all the time, is how do we design the type of care that women are looking for? And, honestly, some people will not be happy. Once in a while we're told, you guys are recommending too many medications and I didn't want medications. I'm like, okay, like, I understand that if you're not really looking for medical care, you're looking for only supplements, we might not be the right person for you. But if you're hormone curious, we're not going to make you take hormones. We're just going to suggest, here are your options and you choose. So that's really what it's about, is our job is to give you the options and then to let women choose the type of care that they want.
Just across genders and age groups and demographics, like, that's, I think, from the healthcare system, like, what people want is they want somebody to listen to them and they want someone to adapt the care plan to them. And if they start to go off script, they don't want to be told, hey, we can't talk about that. So it's solving that broader problem too. And you even said, we may have started like potentially too narrow, and now we're kind of going where the women are telling us. How do you communicate that, right? Like, how do you evolve that communication? Because there's already like the care gap and the knowledge gap, and maybe even like a comfort gap around menopause and some of the conditions. And now we're saying this is women's health kind of broadly. How do you navigate like being too broad and being too narrow?
Yeah, so it's an interesting challenge. So I'll give you an example. 85% of the women coming to us want to talk about their weight. 85%. So they may or may not be eligible for a weight loss medication, or they may have gained 25 pounds in menopause and want to know about that. But 85%, one of their top 3 issues is weight. So we put in a weight protocol, and then we also enabled people to select a weight visit. And we thought, okay, that will solve the problem. And then all these people showed up to the weight visit, and the first thing they wanted to do was talk about their hormones. And they were frustrated that the weight visit was not a hormone visit. And so that's an example of how it's all actually deeply interconnected, right? So now they come to a weight visit, and then they also want to talk about, actually, also my hair is falling out, and my skin is not looking as good, and I haven't had sex with my husband for years because it hurts. Can you help me with that too? So that's how we've discovered this is all interconnected, because you start talking about one issue and then they just keep spiraling to more. So our goal is to become their care partner, and then they can come, and we have to, actually, one thing we had to do is we had to change it. We can't take care of 10 symptoms in one visit. Yep. So we try to say, okay, we can take care of 2 symptoms in this visit, and then come back and we'll talk about the next 2 symptoms in the next visit. One of our providers said she used to say, okay, I have a magic wand, and if with this magic wand I could solve your top 2 issues, what would those be? And then we'll move on to the next 2 and the others. But once someone has a care partner who cares about them and understands them and works with them to feel better, then they want to come back over and over to get more care.
What type of challenges does that create from the kind of like care provider side in terms of, hey, this is who we're bringing in to deliver the care and conduct the visits and make sure that we can solve this kind of diverse and evolving array of issues?
Yeah. So we've created 40 care protocols so far, and now we have to just keep on creating more because we are getting different issues that we get asked. And then we have to train the providers on these new protocols. It's hard. It's a lot of work for them. And the way that we do it is we have care protocols that we do. We have weekly sessions where we have experts on different areas come and present to our entire care team on different care issues. And then we're able to use AI to basically review all the charts and make sure that people are following the highest care possible. And then we can identify if someone has weaknesses in certain areas. We can then go and help them to remediate. And then also our care is all done by nurse practitioners, but we have physicians on the back end, and they are available for questions. So we have a lot of people who come to us and they have cancer or they have, other complex care issues. And we have physicians on the back end who can then make sure that we're giving good care for both the easy cases, but also the more complicated questions.
So as you're building out these care paths and the teams to deliver that, there's a challenge there with doing this virtually. And are these employees? Is it partnerships? Are they contractors? When you started, and maybe even now continue to figure this out, how do you think about like that workforce and building that, broader team?
So ours is employees. They work for us. We believe that the most valuable thing I am offering is expert care. You can't do that with contractors. You can't do that with people who are not pretty dedicated to your company. So we have full-time and part-time employees, but we require a minimum number of hours per week because we're giving longitudinal care. I want a patient to be able to come back and see that same provider over and over again. So it's not popping in and popping out. This is longitudinal care. So yes, the business model is that we hire them, we give them days off, we give them benefits. They are our employees. And my goal is that they love working for us and they want to stay with us for 20 years because I want to keep a patient for 20 years. The best way for me to do that is to have a provider who wants to stay with me for that long.
And do you find, we hear just you turn on the news or just looking across maybe social media, like healthcare shortage, there's not enough healthcare workers, nurses, all these sorts of things. Are you running into that same problem, or is it, no, this is actually a benefit and maybe it works in your advantage that people want to work for a company like yours?
So, we spend a lot of time thinking about this and how to make it a great work environment for the providers. I really think I have 2 sides of this equation. I need to make it a great workplace for my providers. And there's ways that I can do that. I can offer good wages, but honestly, I can also offer them flexibility. Most people, when they work in healthcare, have no flexibility. We have built an organization that does give them flexibility. And if they let us know in advance, they can go see their daughter's school play. They can go take care of their parents. Like, we are trying very hard to build a flexible work environment for our staff of people who they feel like we care about them and we want them to be successful and balance their life in a way that is positive for them. And that's a massive differentiator for us versus anyone else. So it means that we have a lot of people who want to come work for us.
key piece of that is like delivering virtual care, having that added flexibility, much like the employee versus contractor and how to think about that. There's also the hybrid versus in person. There's certain things that are maybe easier to do in person or people are more comfortable doing in person versus the convenience and the delivery of digital telehealth. How did you think about like that model and when and how you maybe partner with a primary care physician or what you're able to do virtually versus what you're not and how that continues to evolve?
Our key differentiator is that we are going to do great virtual care. I don't have a better way of doing pap smears, and I don't have a better way of doing blood tests. And honestly, women need mammograms, they need colonoscopies, they need hysteroscopies, they need endoscopies. Like, I need to have places to send them to get the in-person care that they need. And we're working hard to have partnerships around the country to give people the in-person care when it's appropriate. Our key differentiator is that we have set up a really good virtual system, and I don't want to go into the in-person care. I can't differentiate there. What I can differentiate on is the experience that we've built virtually.
The Fitt Insider Podcast is brought to you by our friends at EGYM. This is an exciting partnership for us, and not just because EGYM makes some of the most innovative fitness products out there, but because the entire EGYM team, led by their CEO, Philip, is committed to making health, fitness, and well-being more accessible for everyone. And that's a mission we can get behind. By combining their smart equipment with integrated software and hundreds of connected partner brands, EGYM helps fitness facilities stand out by delivering a personalized, gamified workout experience that improves outcomes and member engagement. So if you're a gym or health club operator thinking about how to best serve your members while driving business results, go see what EGYM is up to at egym.com. As you're describing this and the evolution of the offerings and the care paths and all these things, I can't help but think of like all the various companies that are delivering, maybe somebody's coming at it from like health optimization, and maybe somebody's talking about holistic wellness, and somebody's talking about a weight loss solution. And then once you're in there, they are delivering a lot of maybe the same things or complementary things. How do you position it and market it and talk about it in a way so that coming through the front door, people know what they're getting, and you're getting the kind of right core customer and audience demographic that you're looking for versus somebody else who might make their way to a weight loss platform or a health optimization platform where it's not what they would have gotten if they would have come to you?
I love that you're talking about front doors. I actually joke a lot that we have front doors and side doors, and we need to understand what are our front doors and what are the side doors and what are the reasons why people might keep on coming back over and over again, even if it's not what we are marketing to you directly. So that's kind of how I look at things, as something as a front door or a side door. Our front door is midlife women's health, and really things that are not requiring in-person care, right? We're not going to be diabetes care first, but we have women who come to us and end up having prediabetes, and we can help them with that. But they're not coming to me for prediabetes. They are usually coming for the core perimenopause, menopause symptoms. So they're usually coming for sleep, anxiety, joint pain, hot flashes, night sweats, really the core, brain fog, it's a big one, right? The core menopause symptoms. But then we send them to get a blood test. We find out they have other things or other challenges, and we can take care of those things too. But the core offering is around midlife women's health that is not chronic condition things and then also not urgent care, right? We're not going to be urgent care. We're not going to be the place you come for strep throat. Now, honestly, over time, if you've already come to me for 3 other visits and then you text me and Athena and said, can you give me a sore throat medication, we can do that too. But we're not competing for the urgent care business. We're not competing for the hair loss business where you just want to buy a medication like you might get at Hims. I often joke that we're the talking person's Hims. You might want to talk to someone about what you should be taking because your hair is falling out and you're scared. That's a different story. But getting back to the front door, we have front doors, and our main front doors are perimenopause and menopause symptoms. But there are a lot of them. And then people come back to us.
Do you feel, as you're talking about chronic conditions or strep throat, acute, do you feel the kind of pull to do these other things, to grow in that direction? Because I'm sure, there's also the argument to say no, there's so many women in need, and there's so many different symptoms and things that we can treat if we focus on that core demo as you described it. But then there's always, especially, continuing to raise capital and grow, and pressures to, hey, what else can you do? What other demos, what other conditions can you treat?
So, I really think a lot about where we are special, and I really only want to do the areas that we are special. It's hard for me to imagine that we would do a better job at strep throat, using that using that as an example. I mean, you can get that from so many different places, but what we want to be is your longitudinal care provider for many years. And so we want to be the place that you come because you trust us to take care of you with different symptoms that you're experiencing. And we can take care of some of those urgent ones, but that's not our core competency. Our core competency is understanding women's bodies, understanding the challenges that women's bodies have, and making sure that we address those and help them to feel better.
Yeah, it definitely sounds like continuing to go deeper and making sure that you differentiate in your words, like special, and delivering basically what nobody else can, right? You do the
Right.
thing
Yeah.
uniquely that nobody else can. There's other ways, of course, to build that relationship or deepen that relationship, whether it's content or community or education or like even like brand around this. What type of components go into that? Like, how important are those things, maybe now and into the future?
So brand, I think, is key. I need to be your trusted partner, right? I think that's the number one thing, is how do I have trust, and how do I become the place that people trust to be this type of care? So we think a lot about what that means and how we differentiate, how we come across in the world on that. And we would never do anything outside of our brand, right? And so I would never like sell you a product that, honestly, like I wouldn't sell you a product that you could just get at your pharmacy covered by insurance, because that wouldn't feel like that's on brand for us, for example. Now, we might make you a special hair thing or face thing that you can't get anyplace else that we feel really strongly about, and it's a compounded something, like that could be something that we would offer you. But I'm just saying, like, those are things we think about. I think our brand actually lends itself really well to longevity. For example, women are coming to us and saying, oh, I want to have these blood tests and I want to know what else I should take to optimize my health. I want to protect my bones and my brain and my heart going forward. I want to know how to live healthier. Like, those are all very much part of our purpose. So we think a lot about that. Community is really hard for us. We have noticed that a lot of communities stop being evidence-based, and we don't want that. So we need to be the best medical care first and foremost. And I don't think you get that from a community. So we decided that community was less important to us, because we wanted to really focus on our core competency, which is the medical expertise. And so that is not as interesting. The community is not as interesting to us. Yeah, that's what I would say. So most of our efforts go around making sure that you get the highest quality care. That's it. It's, and that's what I want to have the brand for. And that's what I want people to know me for. And kind of that's the filter that I put on everything that we consider doing.
Yeah, I think that's really interesting. And especially when you think about, community as a buzzword, and where and how people choose to apply it and what type of companies are utilizing it. In your case, I think it's actually really smart, because what you tend to have is it almost devolves into like message boards and
Right.
forums. And then it's, okay, maybe you don't want Dr. Google or WebMD like answering your questions, but also you don't want the other person in the forum or community answering your questions either. So it's like a double-edged sword. In some ways, maybe the brand can actually serve and deliver a lot of that value in terms of trust and authority, and continuing to like build that relationship in a way that, you really wouldn't be able to do if you were almost handing that off to the users or patients themselves to try to solve those problems.
I mean, honestly, I love reading Reddit Menopause. I'm fixated on Reddit Menopause and reading what people are saying to each other. Reddit is a great place for Reddit Menopause. I should not be trying to replicate that. Let people there talk to each other, give each other advice. Like, there's so many women on there talking about menopausal weight gain or talking about, their hormones, and let them go to Reddit, have those discussions. That's great. And then if they want the medical expertise, come to us. So that's where I would differentiate us.
Maybe changing gears a little bit, if we zoom out, like and look at the broader conversation, at the start of the conversation, you kind of mentioned the care gap. There's also stigma that goes along with women's health. There's also, when you look at kind of venture funding, the lack of venture funding going to the space, women's symptoms and pain are ignored. So it's not kind of treated in the traditional system, like all these problems. Do you think about, or are you saying like, hey, we're going out there and we are educating people, we're trying to make this shift, we are contributing to that conversation? What role do you play in that now? How do you think about that space and potentially how it improves going forward?
Women's health is a big space, right? So, right, like it's really not been super focused on. I'm not even sure a few years ago when I started this company, people even thought it was a space, quite honestly. Now, I think a lot of people have come to the conclusion that it is a space. I had the opportunity yesterday to talk at the White House, and they did a forum on women's health and women's health research. And they were saying that really this was the first time there'd ever been a women's health event at the White House. So it's new. This is a new concept. Women weren't even included in clinical trials until the 1990s. So it's all new. What I love is I think women are starting to demand it. And women are starting to demand care that is designed around their bodies. And commercial forces actually do a pretty good job at responding to demand. That's what I would say. In the end, like, when there's a lot of demand for something, the commercial world can solve that demand. And so, we are growing really fast because women are coming to us to get their care. And we're working really hard to prove that this is a market, to prove that we can offer something that women need and that they will benefit from. And essentially that's what I have to do, is basically prove that. Right. And so that's what I spend all my time doing, is proving that this is a big market, that women deserve access to great care, and that we can provide that.
I mean, to that point, in the last, I think it's 6 or 8 months now, you've raised almost $100 million, like alone, or maybe that's the total funding. You can correct me on the figures and timeline, but significant amount in the past year. Was that the plan? Is that a response, to your point, like to the market and to the growth? Is that, that pitch, I'm sure, from day one and the 100 or 150 women to now has evolved quite a bit. So
Yeah.
just like even that journey from the funding, the conversations, the interest, what has that been like, and how do you anticipate that continuing to grow?
And I have to go raise more money. The truth is, building a national care company is not an inexpensive endeavor. Building out insurance coverage in all 50 states, building out revenue cycle management, building out the billing and the customer success and the whole thing to basically run a national care company is expensive, but the market opportunity is huge. And we are growing really fast. I mean, I will tell you that when we went out to raise, it was actually 60 that we closed a year ago. And we went out to raise that, we had a projection for next year, and we're already going to do double what we thought we would project for 2025. And it might even be triple. Like, we are growing really fast. It's super exciting.
Yeah.
But, we're growing because women need and want this care, and they're coming to us for the care. And so, we have to figure out how to solve that by making sure that I give really high quality care, and I only offer really high quality care, and that I make sure that my providers are really good at what they do. And as long as I do that, then people will come back. And that's really it's not fancy. I'm not doing something that's like, it's not fancy. It's just very simple. Like, if I offer you excellent care from your house, covered by insurance, you will come back. And that's really what I need to do.
How much of that, when you talk about like raising the money, needing to go out and raise more money, when you started, this wasn't even like a space, or, I'm sure people didn't think it was investable, and there are a whole bunch of reasons. And you hear these anecdotes from, women and female founders that, I was sitting in a room full of men and I'm talking about all these things, and they're basically looking at me like they've never heard these words before. And to where it is now, is it a conversation about women's health and conditions, or is it just like growth, market opportunity, the numbers? Like, you put a chart up and it doesn't matter who the user demographic is. It's just like, you can't deny what's happening here.
Yeah. It's not about, now I'm not being judged on, is women's health an opportunity? The great thing is I can show numbers, I can show patient numbers, I can show margins, I can show a really good path to profitability. I can show why it can be a good business. So now it's really actually a delight to have these conversations, because whether someone funds me or not is not going to be about whether women's health is an interesting place. It's about, is this a business that you're interested in? But it's not like, is women's health a space? But honestly, you know what? I got to say, like, now when I think about what I was pitching 3 years ago, my story's changed so much. Like, I was pitching a menopause company. That's not that interesting. Menopause, right? Women's health is much more interesting. And we didn't understand how that correlated, how it worked together, right? That you would come to us for hormonal help. Hormonal help is 1 or 2 visits a year, right? But then if you add on that you're having mental health issues, or you add on that you're having sleep issues, or you add on that you're having other issues, and you can take care of all those things, that's a really interesting business. I mean, we've prescribed 450 medications, right? So that just shows you, like, we're not just a hormone company, right? We are very much a holistic healthcare company. And that story has resonated.
Irrespective of the industry or the market or what may or may not have been stigmatized or well understood before, you can go out and be an advocate for something and champion it and educate people and kind of yell from the mountaintops, or you can just go out and win. And if you go out and win, you do the work of validating like you did it. And so now anybody that comes kind of next or is trying to do something in the similar space, it's like they just point to you and say, like, it can be like that. It can be that big. We can grow that fast. So you end up doing that just by executing.
It's a lot of pressure on me. I feel like, I have to prove that once we will prove that this can be a massive company. I think there'll be a lot more. Like, I think we're kind of going to show that you can build big companies in this space, which is exciting.
What's on the roadmap? What should we look forward to? What are you looking forward to as you continue to grow?
We're going to stick with women's health. We are very much thinking about, do we go older and do Medicare, or do we go younger? And, for example, I have a daughter who lived in DC, and then she lived in New York, and then she's in California. She can't find doctors in these 3 places that she's gone to, right? So do we go into that market and make sure that those women have a place to go to get healthcare? That's another thing we're analyzing. So I think eventually we go older and younger, but we're trying to figure out where we go first. Then, as I mentioned, like, there is a lot of interest in our audience about preventive healthcare and making sure that they are thinking more proactively about their brains, their bones, their hearts, making sure that they are doing things that, that word is more health span than longevity. Women are not as interested in longevity, seemingly, as men, but they are interested in taking care of their grandkids. And I joke about that all the time, honestly. Like, they really would love to take good care of their grandkids. And what does that mean? It means exercising now and lifting weights more so that you can stay strong. It means maybe, testing more often to see about heart disease, or there are a bunch of things you can do now in your 40s in particular that will help you to be that great grandma you want to be. It sounds funny, but it really does matter. And so one thing I think, like a lot of women, they're much more interested now in being strong and being healthy longer. And we would like to be the place that helps them to do that. So that's another area that we're spending a lot of time thinking about.
A lot of exciting opportunity, but also impact as well, potentially to go out there and figure out. For folks that are listening, want to learn more, follow along, where would you point them?
Yeah, just our website, just joinmidi.com. And we have 50 state coverage. So we have providers who are in all 50 states. We have insurance coverage in all 50 states, some states better than others, but we're doing a pretty good job. By the end of this year, we should have 70% of all PPO lives covered. And we're working on getting that other 30% as fast as we can. We care deeply about making this cost effective. So we are not a fancy cash pay company. You can do cash pay visits, but we are really working as hard as we can to get insurance coverage so that all women get access to the care that we're able to provide.
Fantastic. We'll make sure everything, links, social, everything is in the show notes, get that included, and just really grateful for the time today. Enjoyed the conversation.
Me too. Thank you.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fitt.co. And one more thing, you can learn more about our recruiting and consulting services at fitt.co. That's FITT.co. I'll see you here next week.